the last section as we move in, like basically, what are we going to do about all this? You know, I think you and I need to have just a wrapping up, closing thought conversation around, given what we know, given all that we don't know, how are you and I thinking about this? And can we package that in language that would be useful to someone listening in 2023, moving into the future? And you and I end up on these difficult conversations talking often with the first step of just being honest. You know, all progress begins with telling the truth. I feel like every episode that comes out.
I love that quote.
But it's so timely and pertinent because we can get in the weeds. And I think it's really taking a lot of the pressure off knowing exactly what to do, because being honest, we don't know.
Yeah.
We don't know most things about dementia. We just know that we don't want it.
Yeah.
So just starting with, hey, it's 2023 update on dementia. I don't have much new to give you. Let's just be honest with it. However, there is good news, and that is that we have multiple areas of potential breakthrough that are actively being pursued right now. I have no time horizon on when we might hear some things, but we could see breakthroughs in tools where we could better risk stratify someone, where we could have a higher degree of accuracy on whether someone actually will acquire this disease. We could get breakthrough in diagnostic screening tools. We could have breakthrough on research pointing towards a particular diet or behavior modification that could lower. I mean, can you imagine if this was linked to chronic fatigue or something?
Oh, my.
Or gluten or in fact, diabetes type 3. I mean, these would be game changer breakthroughs. But to me, the smoke and gun, kind of like what we have talked about that have changed the game for heart stratification with Clearly in this virtual heart caths and Grail for cancer screening, like the equivalent for Alzheimer's dementia for me is going to be once we have the proverbial antibiotic for it.
Right.
Hey, we're going to do all that we can to prevent it. But if you get it, we have a tool set for that.
Yeah.
We can treat it. Don't you agree?
Oh, absolutely. I mean, as wonderful a time it is to be alive in 2023, from a medical perspective, this still seems to elude us.
And that may
sad.
seem a weird twist of narrative for anyone who's listened to our content, because you and I in our DNA are preventative in nature. But it doesn't do society very good to do all that you can to prevent pneumonia. And despite your best effort, you get pneumonia. You're going to die without antibiotics.
Right.
You will eventually become septic and die from multi-system organ failure. That being said, I want to steward antibiotics, and I don't think everybody needs antibiotics, and like be thoughtful. The fact that we don't have something, despite our best efforts, if you get it, makes this uniquely complex and stressful.
Yeah.
And I think it creates this situation where there are many things that we have conversations with private members that are similar to this, and you're left in a difficult situation. And I find, and I'll be curious to hear your thoughts on this, taking a two-stepped approach at this and saying, first and foremost, do I, the person who's concerned about the thing, have the right team in place to where I can have these conversations early, often, where my goals and values are aligned, where it's a safe place and I can be curious and I can just talk about these things? Or am I left to do this all alone?
Yeah.
I think so many times we just take that for granted, and it's like, it's the first domino. You got to have a team. The human experience is not meant to be in isolation. And if you have any medical thing, especially dementia, as a primary concern for you moving into your future, ensuring while you don't have dementia that you have the right team in place is really a wonderful starting point. The back half of that coin is, I would encourage anybody listening to this to become fully committed to being their own advocate.
Oh, yeah.
Self-advocacy is something that I have been thinking a lot about. I've been journaling, and I'm going to be creating more content around self-advocacy. I don't think it's enough in isolation, because you can end up down in the weeds.
Mm-hmm.
But in combination with the right team, oh my goodness. Look, doctors are busy.
Yeah.
They care. They're good people. But if you're not in a concierge model like we are, and even we are the least busy docs we know, we get busy.
Mm-hmm.
You know, in a traditional model, you might be seeing 30, 40 patients a day.
Yeah.
There's no time.
Mm-hmm. And I will say, you know, I talk to all of the prospective members that come into our practice before they commit to us. And a growing number of them, the conversation that I have is around that same topic, that they want to be their own health advocate, but their physician or their team is just too busy to help them. Yeah. Or they're not up to speed on ApoB or ApoE, or, you know, all of these things that kind of we talk about. Or maybe they've listened to the podcast and they're like, I took ApoB to my family physician and they don't even know what to do with that, you know. Yeah. And it's not their fault. It's just, like you said, they're just so busy. But being your own health advocate and staying up to date on all of these kind of trending things, medicine moves slow, but it can also move fast, right? And so there's a lot of noise around that space too. So really kind of cutting through to the truth of what makes sense for you and your health. But a lot of these, you know, people that I talk to, they choose us or come to us because they are just frustrated with the sick care model.
Yeah,
it's not preventative focused at all.
Fast is slow, and
yeah,
slow is fast.
Right.
And we tend to like to be slow is fast.
Mm-hmm.
You know, by limiting our membership, and we've created a world where we, for the most part, we don't have to watch the clock.
Yeah.
And we can have these conversations. And if you're listening to this and you're not convinced that you have the right team, go find your team.
Mm-hmm.
Like, it's worth it.
Yeah.
And especially if you're sitting there listening to this and you don't have any real issues, you have some concerns about the future, like, ding, 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 this is the time to do it.
Right.
Because under the gun, getting a diagnosis that you weren't expecting, or having a sudden shift or change in your health, the optics of your health for the future, that can be a very scary journey. And if you don't feel confidence that you have your team, that in that time of need, you have your people, there's a lot of regret that tends to accompany that experience, and a lot of accelerated anxiety. And I hate seeing people suffer.
Yeah.
But I think find your team, and you have to be your own self-advocate in the setting of the right team. And this is the time. I wish we had more to give that would be useful today around a topic that we all think about. But it is, let's have an honest conversation about where it's been a failure. Let's have an honest conversation about where we're at and how to use what we do know and manage all the things that we don't know. But the big thing is keep eyes wide open. I've shared with you before, in the Army, we had this thing where one person would say, stay alert, and the whole squad would say, stay alive.
That's good.
There's something about stay alert, stay alive. Keep eyes open to the things that are important to you. That, combined with the right team, I think really sets you up for the best odds of avoiding icebergs. But if you do find yourself up against an iceberg, to navigate it in an elegant way where you can have the best possible outcome.